Thank you so much for joining us today, everyone. We're here today to talk about demystifying digestive issues, what to consider with bloating, reflux, and changes in bowels. So if you don't know Andrea Hardy, she's a registered dietitian from Calgary, Canada. She runs a digestive health practice called Ignite Nutrition and specializes in gut health and GI diseases. And if you haven't checked out her podcast, I highly recommend it. It's called Let's Gut Real. As for myself, I'm a science, medical, and biotech writer specializing in the microbiome. So my job is to kind of read scientific papers and translate and summarize them for different audiences. I have a book called The Well-Fed Microbiome Cookbook, as well as a co-authored textbook for dietitians and other healthcare professionals called Gut Microbiota Interactive Effects on Nutrition and Health. So Andrea, what are we mainly talking about today? Are we aiming at people with diagnosed GI conditions, or mainly people who have symptoms but don't necessarily have a diagnosis?
Right. So today we are mostly focusing on people that don't actually have a diagnosis, because a lot of times patients can experience digestive symptoms, but maybe don't fall into specific diagnostic criteria. And so they're kind of told, oh, well, it's just bloating, it's just gas, it's just a bit of reflux. But, we don't have a specific diagnosis for you. So, here's a couple lifestyle changes, go on your way. And people feel really frustrated with that because they're like, okay, but I don't feel good. What else can I do? And so I'm really hoping today that we can cover some of those, what you can do for these conditions or these symptoms that maybe don't necessarily fit into a specific diagnosis.
Yeah, and I could really relate to that myself, because I think it was about 10 years ago, I was having, very distressing symptoms, and it was really impacting, how I did my work and how I lived my life. And, I didn't get a diagnosis. And so, I would have loved to have, I think, these sorts of resources to have to try out. So now let's get into the most common digestive complaints. So I know everyone has some digestive trouble from time to time, but what are the most common digestive complaints?
Yeah, so the ones that I see the most in practice, even sometimes above a diagnosis, are things like gas and bloating, which can be really uncomfortable or can really disrupt your quality of life. Things like reflux, where it's occasional and not enough to warrant medication, for example, but can influence a person's quality of life. And then, of course, constipation and diarrhea. And so those are kind of the big things that I see that don't necessarily fall under diagnostic criteria, depending on the frequency of symptoms, but still cause a lot of distress for people.
Mm-hmm. So, I know you and I were used to talking about these subjects because of the nature of our jobs, but there does seem to be still a taboo around digestive health. And I got curious about this, and it turns out, there is a very long history of the taboo around digestive health and elimination. I mean, in some ways it's not surprising because no one likes to call to mind unpleasant things. But, I was interested to learn that even before people really understood the digestive process scientifically, they sort of created myths about it. And in the Renaissance period, the stomach and intestines were sort of thought of as impure organs, and the spirit of the body did not occupy those regions. It was sort of like second-rate organs. And then I think we also have to remember through history there was a lot of issues with sewage control and sanitation. And I think also this, influenced people's willingness to talk about it. It's like, if there was a sewage problem, one example was the Great Stink of 1858 in the UK, where the Thames was like overflowing with sewage, and people didn't want to acknowledge that they had any part in contributing to it. So of course, today we enjoy very good sanitation, many of us. And so mostly we can sort of avoid encountering and acknowledging digestion and elimination in our daily lives. but it still remains a taboo topic. However, in recent decades, there have been a few people that have really helped break the taboo. One of them is the actor Jamie Lee Curtis. So I don't know if you have seen, it was years ago, but she did some commercials for Activia, and the language she used there was, to address occasional irregularity. And of course, the strain of probiotic in Activia had been studied for that. And you can bring up her photo, I think it's there. So there we go. Yeah, that's Jamie Lee Curtis. And then she also had a line in the commercial that things your body doesn't use could be lingering in your system, causing discomfort. So that's alluding to constipation. So she really brought that to the public, that it's okay to talk about that. And then the next picture here is of Shakira, who was the later spokesperson for Activia. And her line was sort of dare to feel good and talking about digestive health. And there was a commercial of her dancing in the forest with this beautiful sort of fairy light around her belly. So I think they did a lot to kind of break the taboo in the first place. And then now, as you may have noticed, Andrea, that digestive health has really gone mainstream. How often does gut talk come up when you're on social media?
Yeah, so for me, it comes up every day, all day. And that's because I've really taken the approach to help kind of demystify and destigmatize gut disorders. So specifically on Instagram at Andrea Hardy RD, I do a lot of work educating healthcare professionals and the public on digestive disorders and kind of getting people comfortable talking about poop and gas and things that we all experience but are afraid to talk about. And so it's really incredible to see people reach out to me and share their stories. So they'll direct message me and say, thank you so much for sharing your experience, or telling me about this. I thought I was the only one. I didn't know this was normal. I was able to have a conversation with my doctor now because of your particular post. And so it's really great to see how more healthcare professionals are sharing resources through social media. And we're getting away from that like traditional top down, this is digestion in a doctor's office, to making it a bit more fun and interactive and connective on social media.
Definitely. Yeah, very important work. And, I think there are also some kind of mainstream books and documentaries that have brought this to consciousness for people. The one that comes to mind for me is Gut by Julia Enders, which is just a really enthusiastic take on the biology of, elimination and digestion. Another one, The Nature of Things. Everyone in Canada may be familiar with that. And they did an episode, It Takes Guts, that was very popular. Even years ago, the Book of Awesome, I don't know if you remember that, by Neil Pasricha. It had one of the awesome things in that book was the colon. And it had a chapter describing how awesome the colon is and just what a wonder. So I think... Yeah, and all these things kind of they've brought the this topic to more prominence. And the other thing I want to mention is that I think now we talk about the microbiome a lot, and so the microbial component of poop is much talked about, and so that may be another reason, because that science is advancing very quickly and people are really interested. That could be another reason why it's becoming more prevalent to talk about it, and it's sort of fun and trendy.
Right. People are getting so excited about the gut microbiome, which I think demystifies some of the conversation around bowels.
Yes, absolutely. And so here's the why talk about it, and I love this line from Mr. Rogers, of all people, the famous children's entertainer. Anything that's human is mentionable, and anything that is mentionable can be more manageable. Of course, he was talking about emotions, but I think it can also be true of bodily functions such as digestion. So it's like the act of talking about it can empower you to manage it. So I think that's one of the key takeaways, that I hope people take from this conversation today. And Andrea, do you notice in the clinic that, when people talk about their digestion to you, it helps you help them?
Absolutely. So, it's often a really uncomfortable topic for people, and I joke that I talk about poop all day, every day. So it's comfortable for me, but when somebody comes and sits in front of me, it's not so comfortable for them. And so really getting all of the nitty-gritty details really helps me to help patients. And that's because the more I know about your symptoms and what's going on, the more I'm able to kind of piece together pieces of the puzzle and then work on nutrition changes, as well as relay that back to the physician. Because sometimes it's hard to bring up to your doctor how distressing it is to maybe pass really smelly gas, or how upsetting it is that you need to urgently run to the bathroom in the middle of a meeting after, having a cup of coffee or having a couple bites of breakfast. And so those sorts of details really allow your healthcare provider to come up with solutions. So ultimately, I want to figure out what's most distressing to my patients, what's impacting their quality of life the most, so that we can better help them find solutions.
Yeah, makes total sense. And in terms of, talking about it, I think it's clear the doctor's office, the dietitian's office are great places to talk about it. Other than that, I think it does warrant a little bit of discretion as to who you tell, because I'll acknowledge not everyone loves to talk digestion, especially over the dinner table. But I was talking to Anusha Gandhi. She's a patient advocate for digestive disease and pain. She'll be talking in one of my other talks in this event, but she was saying to me that she talked about it, her digestive issues online in the communities there before she ever brought it up to her family or her partner. And I think that's worth mentioning, that maybe some of those online spaces and, on social media like you do, and Andrea, they can be safe initial places to start talking about symptoms and hearing about others' experiences. So another just quick tip is probably it's a good idea to give fair warning before launching into details of your symptoms. Just a brief sentence like, I've been having some digestive issues. Do you want the details? Just kind of good communication practice to give a little warning. And then the last point I wanted to make is that once you've established that you're going to have a conversation about some details of digestion, that it's best to be calm, clear, and matter of fact, and use the correct language. At that point, you don't have to dance around the issue. You can use the word, whatever it is, bloating, poop, diarrhea, and just be clear. And so I think throughout the rest of the presentation, Andrea, you're going to help us. You're going to give us some of that language that would be appropriate to use. Let's get into the details. So starting off with gas and bloating. So what are these?
Yes, so bloating is the feeling of fullness. So it's that feeling that your tummy is just full of gas or full of something, and it can be really uncomfortable. And then distension is actually visible expansion of the gut. So this is that, like, a lot of my digestive patients might describe it as like getting that like pregnant belly bloat, where we actually see expansion. And so that would be kind of some nuance in language there that patients can be aware about when they're describing their symptoms.
Yeah, and I think it's really good to distinguish those two, because I wasn't aware that bloating and distension were so distinct. I always thought of bloating as, the kind of bigger belly that happens after a meal, but I guess that's distension technically.
Yeah, it is.
Yeah. Okay, awesome. And so how about gas? What is that?
Yeah, so gas can include flatulence, or it can include burping. And so being clear about where you're noticing the gas and what gas is bothering you can be really helpful for your healthcare provider to understand, okay, where is the problem occurring in the gut, and what's kind of happening that could be causing the flatulence or the burping. And I think healthcare providers are fine if you call it farting or tooting. My cousin made fun of me because I called it tooting on a TV segment once. So really, whatever language you use within your family that you're comfortable with is great too.
Great. And so when it comes to gas and bloating, what is normal, and then what would signal maybe you should go see a professional about it?
Right. So I think what's really important to note is bloating and distension are normal. It's normal part of digestion, because when we eat, what happens is there's that expansion of the gut due to either fermentation or water being pulled into the gut, or when we eat too much. And so all of those things are really normal, but when it becomes a problem is when there's pain and discomfort associated with it. So when it's constantly impacting your quality of life, you're experiencing a lot of abdominal pain or discomfort, that's kind of when we say, okay, bloating and distension, maybe there's some things we can do about it. I think it's really important to highlight, because of social media, there's this big movement around, flat stomachs, and then people showing, if you're following people that talk about their digestive experience, people showing their flat belly in the morning and then their bloated belly in the afternoon. And I think that bloating can be very normal. So having that expansion of your gut's doing exactly what it should be doing. It's more if it's associated with discomfort and pain that we're concerned about it, and we could possibly make some changes to help reduce some of that. Gas as well is normal. So passing gas is completely normal. We produce about 2 liters of gas a day. And the average person passes gas about 13 to 21 times a day. So a lot of patients are like, I think I have too much flatulence. I think I fart a bit too much. But it is really normal to be passing that gas, although it can be distressing, especially if you find the gas is a little bit more odorous, or if it's causing pain. So those are some reasons you could talk to your healthcare provider about.
Mm-hmm. Yeah, it makes sense. I also think it's interesting how, and of course, I always think of the gut microbes, and it's interesting how the gut microbes have a role in producing gas. And, I was just thinking about Dr. Fernando Aspiras. He is a researcher in Spain that I was talking to for an article, and he was explaining how, gas is produced in the colon, and the gases that are produced are hydrogen and carbon dioxide. And he was saying that certain people have also methane produced, but the reason you would produce methane is if you had a microbiota, like a community of gut microbes in there that was methanogenic, that tended to produce methane. So that's sort of a sign, and methane can be, again, a little bit smelly. So that could be a sign that your gut microbiota is not really optimal because it's producing methane. So I think it's hard to know what to do about it at this point. I think they're researching sort of dietary interventions that could shape your gut microbiota so it doesn't produce so much methane, but that's, a space to watch.
For sure. Yeah. So it's very interesting to see how those byproducts of that microbial fermentation can really influence digestion and how we experience it.
Yes, exactly. So how can people manage if, they have gas with a lot of pain and discomfort?
So in terms of getting back to managing some of those digestive symptoms, I like to say it's all about getting back to basics. And so what I mean by that is you'll find a lot of crazy nutrition recommendations out there, restrictive diets, cleanses, pills, and potions. And at the end of the day, nutrition is rarely that sensational or extreme. And we find that when we look at the research, it really is all about getting back to these very simple strategies to help manage symptoms. And then from there, if we're not quite managing as well as we'd like, then seeing a dietitian to layer on additional strategies can be helpful. And so ultimately, there's some other ways to manage it as well, such as targeting the gut microbes. So this is where a dietitian can help. In particular, the low FODMAP diet is a type of diet that reduces carbohydrates that ferment in the gut or pull water into the gut. And those two things can contribute to gas, bloating, and distension. And so I actually have another talk in this series, if you want to check it out specifically on the low FODMAP diet, if you hadn't heard of it, or were looking for a dietary intervention that specifically targets gas, bloating, and distension. And so ultimately what we do with those particular diets is we reduce the fuel that exists that feeds them and then produces that gas. And so the low FODMAP diet essentially minimizes the amount of fermentable carbohydrates and can reduce some of those symptoms. Another big one is gentle movement. So of course, getting some movement can help your digestive tract to kind of move that gas along and pass that gas. And so simple things like walking or a little bit of yoga can really help trapped gas or gas that pools in a particular area of your intestines move along. On our website, actually, at Ignite Nutrition, we do have a yoga for digestion video that one of our dietitians, whose also name is Andrea, has created. And that's free if you want to check it out. It's just at ignitenutrition.ca, and you can search yoga for digestion.
That's a great resource.
Yeah. It's amazing. She did such a good job of it. I don't practice a lot of yoga, and I found that it was very gentle and very inclusive for people that aren't, yoga pros. So it's really for everybody. Another big one is to wear clothes that are comfortable and that fit. And so tight, restrictive clothing can increase our perception of pain and discomfort with bloating and gas. And so we want to make sure that we're wearing pants that have a little bit of room to move, especially if you experience distension regularly. So tight pants can really perpetuate that feeling of discomfort. So wear pants with a bit of stretch. I am all about those yoga pants or leggings that have a little bit more room to them. Watch for things like tight belts or like cinched waist pants or like dresses that zip up in the back and really pull things in because that can be uncomfortable too. And then for females, bras as well. Having a bra that fits, that isn't too tight, is really important to prevent that feeling of restriction and help with some of that digestive discomfort. So those are some things people don't typically think about. And then it's really important to know that if your bloating and distension is accompanied by pain and discomfort, that you talk with your doctor or dietitian. Pain is more of a predominant symptom of irritable bowel syndrome. And so there might be other strategies to help manage your digestive discomfort. Some other big things include things like non-pharmacological options, so over-the-counter options for gas and bloating. You can definitely talk with your pharmacist, but I think a lot of people have heard of things like Beano for when they consume things like pulses, so chickpeas, beans, and lentils, or peppermint oil capsules, which have been shown to help reduce sensations of bloating and discomfort. As well as things like simethicone, or somebody might recognize the brand name of that Gas-X. And so these sorts of things are available over the counter, and your pharmacist can help guide you on what might suit your symptoms best. So definitely talking to them can help. Some other strategies include things like slowing down when you eat. And I'm horrible, Kristina, at slowing down when I eat. I eat quite quickly, and so I swallow a lot of air, and that causes a lot of my bloating, actually. And so when I slow down and don't talk so much when I eat, it actually helps to make sure I swallow less air and reduce my digestive discomfort. Also, slowing down when you eat allows you to tune into your hunger and fullness signals so that you don't overeat. There's definitely some foods that can contribute to gas and bloating. So I encourage you to tune into my low FODMAP presentation on this event to kind of see some of those foods. Some of them are obvious, like things like cauliflower, of course, are more gas producing, or beans are more gas producing. But sometimes people are surprised that onion and garlic are also quite gas producing. So that's a great presentation to tune into. And then again, if you're experiencing a lot of pain, discomfort, or you've had a sudden change in bowel habits, make sure you talk with your doctor.
Yeah, makes sense. And as for low FODMAPs, I've even seen some products in the grocery store specifically for low FODMAP these days. So I look forward to hearing about the diet in your presentation.
Yeah, there is a lot of really great products. A lot of foods are inherently low in FODMAPs too, but it's nice to see those specialty products. Like I had mentioned, onion and garlic can be quite gas producing. And how do you find a tomato sauce or a soup base without onion and garlic in it? So there's definitely a lot more great products out there. Fodi Foods is one brand that has a great variety of products. You'll see them on the shelves of different sauces and condiments and soup bases and all of that to meet a person on a low FODMAPs diet needs in terms of not having to make everything from scratch.
Mm-hmm. Great. So let's move on to the next sort of group of symptoms, and this is heartburn and reflux. So can you tell us what is this?
Yeah, so heartburn or reflux, GERD, is essentially when acid splashes up from your stomach where it should be contained up into the esophagus. And so this can cause damage to your esophagus over time. It can irritate your mouth, it can irritate your sinuses and cause chronic cough. A lot of patients wake up and they feel like they're kind of like mucusy in the morning. They might have a sour taste in their mouth. And they might notice that they're a bit more congested, and that can be a symptom of reflux.
Mm-hmm. It's interesting. In my previous job, I worked with people with communication disorders. And so some people, GERD had even caused voice issues, and severe GERD would irritate people's vocal cords and cause them to lose their voice, and which could be quite a problem if you use your voice for your job, such as, if you're a teacher. This can be quite serious for people.
Yeah, absolutely. And so it definitely can impact your voice. It can impact your oral health. It can impact the actual cells in your esophagus, and it's a risk factor for developing esophageal cancer. And so if you experience it, make sure you talk with your doctor. And really it's the frequency of it that determines, should there be medication involved, or maybe is there other strategies we can use instead?
Great. Yeah. And so, can you give us the rundown on what's normal when it comes to this? And I guess I should probably define GERD, gastroesophageal reflux disease, that acronym I was using. So what is normal when it comes to this symptom?
Right. So typically I like to say that if you're experiencing it weekly, so once a week, definitely speak with your doctor or dietitian to see if there's things that you can do to help manage. So it's when it's frequent and recurring that we're kind of like, okay, there's something that we should need to do about this. Whereas, reflux once in a while after a big dinner out or a holiday meal can be normal. We can overeat, and that pressure in our stomachs can cause the valve that prevents acid from splashing up to kind of open and allow some of that acid up. So sometimes it's because of some of the dietary choices we make once in a while, whereas if it's happening more regularly and you're not really sure what it's tied to, definitely speak with your physician.
Yeah, it makes sense. And so, if someone has occasional reflux, what are the best ways to manage it?
Yeah, so one of the big ones, again, like I mentioned, I'm really bad at this one, but I try to teach it to my patients, is to eat slowly and mindfully. And that's so that you have time to properly chew your food and start that digestive process. And it also helps to prevent you from swallowing air, which can increase pressure in the stomach and cause that valve to open a bit more. And so one thing that I find that works really well is before you go to eat, just put one hand on your tummy, one hand on your chest, and take 5 deep belly breaths, just checking in with your body, seeing where you're at in terms of hunger and fullness, and just kind of centering yourself, because we're so busy, we eat on the go, we're rushing, and all of a sudden, all of our food has disappeared off of our plate in 2 minutes flat. And that can lead to overeating if we've eaten too quickly, as well as that indigestion and reflux. Another tip is to, instead of having larger meals throughout the day, have small frequent meals so that we decrease the volume and that pressure that builds up in the stomach. And so having 4 to 5 smaller, more frequent meals can reduce reflux as opposed to 2 to 3 larger meals. Another big one for reflux is watching those trigger foods. So reducing intake of acid-causing foods. And this includes things like caffeine, which can cause that valve to just kind of open a bit more, alcohol, spicy food, high-fat food is a big trigger for people, acidic foods, so things like tomato sauces, citrus, orange juice can be triggers. Mint, because it relaxes that valve in the between the esophagus and the stomach. And then highly processed foods, just inherently because they tend to be higher in fat and sugar and lower in fiber, and can slow digestion down a bit and can trigger more symptoms. Another good tip is to focus on getting more fiber in the diet. As a dietitian, this is what I talk about all day long, is trying to get in more fruits, vegetables, whole grains, nuts and seeds, and pulses. So beans, peas, and lentils. Fiber can help to improve how quickly things move through your gut and can reduce some of that pressure in the stomach. If you find you get reflux before bed or overnight, if you're waking up coughing or with a sore throat in the morning or with sinus irritation, stopping eating 2 to 3 hours before bed to really let that stomach empty and the digestive process to kind of ensure that things have moved through to the small bowel. You can actually get a wedge for your bed as well. I used one when I was pregnant because my reflux was horrible. And I got a wedge, and it really helped to just create that incline so that things are less likely to splash up because gravity is helping to hold them down. Like bloating and gas, loose clothing can be really helpful. So making sure you have nice loose clothing to keep the pressure off the tummy so that it doesn't create that mechanical pressure. Stress management techniques can be really effective. Your diaphragm is involved in how your stomach accommodates space when you eat. And so deep belly breathing can actually help your diaphragm to naturally move how it should to make room for your stomach. And then, of course, medication management. So if these things don't work to manage your reflux, medication should be considered because we really want to protect that esophagus and make sure that it doesn't get damaged and doesn't put you at risk of abnormal cells in the esophagus or esophageal cancer.
Yeah, makes sense. Okay, so the next group of symptoms we'll talk about is constipation and diarrhea. So I think people may have a basic idea of what these are, but how are they really defined?
Yeah, so the CDHF has some great graphics that are really helpful to put into perspective what constipation and diarrhea is. And so constipation is the passing of hard stools. So usually stool types 1 and 2, which we'll get into, but those are those hard, lumpy rabbit poop stools, or those sausage-shaped stools that are lumpy and uncomfortable to pass. Typically less than every 3 days, greater than 25% of the time. And so this could be, a few days a month of experiencing this sort of bowel pattern. Whereas diarrhea is the passing of soft stools, so type 6 to 7. So that's watery stool or fluffy pieces of stool that are raggedy or mushy. And so this can be more than 3 times a day for at least 25% of the time. And it's important to know with constipation and diarrhea that pain isn't a predominant feature. So it's more the if frequency and consistency of stool as opposed to pain. If you experience pain with your constipation or diarrhea, it might better fit into the diagnosis of IBS because pain is the predominant symptom of IBS. So make sure you chat with your doctor. And so with these symptoms, it's important to know that you should talk with your doctor if there is a sudden change in your bowel habits as well. So this typically has some chronicity to it. If it's sudden onset, that's a concern that there could be something else going on that isn't just simple constipation or diarrhea, whether that's foodborne illness or gastroenteritis causing diarrhea, or whether there's something going on in your colon that needs to closer look at. So we want to make sure if you're of a particular age or certain risk factors that you're screened for colorectal cancer if you've had these sorts of changes suddenly in your bowels.
Mm-hmm. And speaking of IBS, why is it that for some people, the body alternates between constipation and diarrhea sometimes?
Yeah, so there's a few reasons for this. So with IBS, we see there's a diarrhea type, a constipation type, and then there's a mixed type. And this mixed type, patients see constipation some of the time, and then they swing way over to diarrhea, and they just can't get a handle on why their bowels are swapping back and forth. And so some of these reasons include things like stress. So stress can be a big trigger for diarrhea. When you experience a stressful event, it can cause your nervous system to say like, hey, let's get rid of everything in here. And so, for example, if I'm giving like a big talk or I'm going on TV, my gut gets going real quick. And I think a lot of people experience that too. And so stress can be one of these causes. Another thing could be dietary triggers. So certain foods or certain food components that cause diarrhea. For example, coffee. People maybe that don't drink coffee every day might have a coffee once in a while and wonder why they have to run to the bathroom when they've struggled with constipation the rest of the week. Another thing could be just fluctuations in fiber intake. So I see a lot of patients eat good amounts of fiber Monday through Thursday, and then Friday rolls around, the weekend kicks off, and their fiber intake plummets. And so with that, that can inherently slow your bowels down. And then by Sunday, you haven't had a bowel movement and you're like, okay, what's going on? And so making sure that you keep your fiber consistent is really important for bowel regularity. And then the last big one, I'd say the most common in IBS would be something called overflow diarrhea. So essentially what happens is the stool in your colon, that hard stool, type 1 or 2, kind of builds up. And then your body's trying to evacuate it. So all of this loose stool moves around the hard stool and you get diarrhea. And then you might get some of those harder PC bits after. And so we see this fluctuation between constipation and diarrhea in patients that really have constipation and really need that constipation managed before we can, manage that diarrhea aspect. And likely if we resolve the constipation, the diarrhea wouldn't be there.
Makes sense. Mm-hmm.
And so I just wanted to highlight this a little bit larger. This is the Bristol stool scale. So it's a good way to describe stool consistencies to patients or your doctor up at the top. And so the constipation type, again, is those hard lumps or that lumpy sausage-shaped stool. And then diarrhea is really that watery, mushy stool. And then in between is that nice snake-like soft stool that we're all trying to achieve or have more regularly. And so this can be really helpful to understand where you kind of fall in terms of bowel habits and whether that's more constipation, diarrhea, or maybe a mix of both.
So in terms of your, bowel movement consistency here, what is normal and what isn't? When should it trigger maybe a doctor or a dietitian visit?
Right. So for me, the biggest thing is, are your bowel movements impacting your quality of life? Because we talked, the normal is, or the abnormal is, more than 3 bowel movements a day for diarrhea, or less than, or a bowel movement less than every 3 days for constipation. But my patients will say, Andrea, I feel uncomfortable at day 2. Shouldn't we do something about this? Well, yes, absolutely. If you're noticing that your bowel habits are causing impacts on your quality of life or comfort, for sure talk with your doctor, because there's definitely ways to manage both before you hit that extreme of, okay, this is a diagnosis of diarrhea, constipation, or IBS. If it's distressing to you, there's definitely things that can be done.
Mm-hmm. And so can you give us some tips on managing, first constipation, then diarrhea?
Yeah. So with constipation, like I said before, with nutrition, it's all about getting back to the basics. It isn't super sexy, but fiber and fluid are keys to managing constipation. They're not the be all and end all, and it's important to know that fiber and fluid isn't going to fix everybody's constipation, but it's important that we have a solid base to work on to solve that constipation problem for patients. And so getting adequate amounts of fiber and enough fluid is important. And so in terms of fiber, it's 25 to 38 grams a day. And so a lot of times, just for simplicity's sake, for this talk, what I would suggest is tracking your intake in an app like Chronometer, just to see what you're hitting in terms of fiber intake on a typical day. So you have a sense, do I need to bridge that fiber gap in some way? And some great fiber boosters are things like a handful of raspberries, a couple tablespoons of nuts on your oatmeal, adding in some pulses, so some beans, peas, and lentils to a salad or a chili or a soup. There's lots of different ways you can sneak fiber in without totally having to change your whole diet. In terms of fluid, we want to aim for about 2 to 3 liters of fluid a day. A lot of people say, can coffee count? Yes, a lot of people think it's 2 to 3 liters of just water, but all fluids count towards your fluid intake. We want to have regular intake. A lot of times constipation can be caused by not eating enough and not eating regularly enough. And so regular balanced meals and adequate intake helps your bowels to actually stimulate regular contractions and regular movement. And so skipping meals, or only having 2 meals a day, which is kind of popular right now with intermittent fasting, can potentially exacerbate constipation for people. We talked about movement before, and then the last one, which we haven't touched on, is toileting behaviors. And so what I mean by that is actually how we position ourselves on the toilet. And so if you're short like me, when you sit on a toilet, your feet kind of barely touch the ground. And so what we actually want to see to easily pass a bowel movement is actually to have your knees above your hips. So simply just put a stool in front of the toilet, or if you've heard of a squatty potty, have that. Put your feet on it so that your knees are above your hips, and then that positions your colon as well as your pelvic floor in a way to allow and facilitate ease when you have a bowel movement. And so that can really help and make a big difference for people. In terms of diarrhea, a lot of the things that we do for constipation also work for diarrhea. And so regular balanced meals are important for diarrhea too. When we have too much food in one sitting, or too much of certain types of foods in one sitting, that can exacerbate diarrhea. So things that are high in fat or high in FODMAPs, especially if we have large volumes of them, can definitely stimulate diarrhea in certain patients. We want to have the right kinds of fiber. And so when it comes to diarrhea management, we want to think about the types of fiber that we find inside of the fruits and vegetables. So not like the hard skin outsides, but the soft inside. So when we think of an apple, we think, the inside of the apple is full of certain types of fiber that can help to bulk your stool and help to kind of make a more cohesive stool, whereas like the skin or the roughage doesn't necessarily help with diarrhea. Things like bananas, where you have that nice soft fiber, can also help. And so again, the FODMAP presentation, we touch on a lot of different fiber tips, so definitely tune into that. We want to remove or reduce things that can stimulate bowels. So a lot of coffee or caffeine, alcohol, and high fats can definitely contribute to more diarrhea. And then consider how stress is playing a role. So if you live a very stressful life, whether that's good or bad stress, we want to consider how stress influences your bowels. Sometimes a simple symptom journal where you jot down anything that's come up around those bowel movements, any stressful situations, can help to begin to show you some of the links that might exist between stress and your bowels in your life. So definitely be sure to do that.
So I think what's clear to me is, from my work, just how amazing digestion is. And I think scientists are still really discovering all the different processes that happen with digestion, especially with regard to the microbes that inhabit different parts of the digestive tract. So I guess in summary, I think digestion is very complex, and it's no wonder that things can go wrong sometimes, or get off kilter. So just in terms of what we have talked about, digestive complaints are very common, throughout history, and today they remain common. And so, it can have a big impact on quality of life and the enjoyment of certain activities if you have symptoms that we've described. But that, many people do feel empowered talking about it in the right context. And, so can you, if you have some of these symptoms, if any of this has resonated with you, then it's maybe a good idea to chat with a health professional, or again, maybe in an online group if you want just the support.
Absolutely. And so a lot of things we talked about today, you can absolutely implement on your own to manage your symptoms. A lot of them, like I said, are just about getting back to the basics, and they might be really small, tiny changes, but can have a huge impact on your symptoms and quality of life. But it is important to, if you're still struggling, if you're still not feeling great, to see a healthcare professional. So this is especially important, like I mentioned, if you have drastic changes in symptoms, or things like unintentional weight loss, blood in your stool, or that sudden change. All of a sudden your bowels are totally different. If symptoms are really impacting your quality of life and these simple things aren't working. And then if you're looking to pursue any big dietary changes beyond the basics, I think that's a great place where a dietitian can help, so that you don't end up on a really unnecessarily restricted diet, and they can guide you in the right direction based on your specific symptoms.
Great. So that concludes our presentation today. And Andrea, thank you so much for chatting about this and bringing your clinical knowledge.
Yeah, thank you for having me. This is awesome.
Yeah,
I'm looking forward to the rest of the talks.
Yes, exactly. So people can join our respective other talks, and there's a great lineup of different topics. And if you have additional questions for either myself or Andrea, you can check out our bios on the site and reach out at our personal email addresses. So thanks for joining.